Hi, I'd like to take this opportunity to talk to you about a new concept I've been working on, getting ready to publish a book chapter on this, and I've been asked to talk internationally on my concepts of personalizing facelifts. I think a better talk for this is actually using a sculptor's eye to create a customized face, because traditionally we've looked at faces as tailors and we create this stretched look that everybody's afraid of. We prefer a sculpted look, and a sculpted look means we have to think in 3 dimensions. So let's stop and think about sculpture. Sculpture is a 3-dimensional structure that has depth, it has edges, not 2-dimensional as a tailor looks at a piece of clothing. And a sculptor is someone who actually creates that sculpture. So if we think about sculpture and we think about the basic elements of sculpture, we have mass, we have space, and we have surface. Mass, if we're thinking about a sculpture and sculpture of the face, it would be the features, the eyes, the nose, the cheeks, the chin. The space is how all these features interconnect with each other, and the surface is going to be the patina, or the finish. And if we're thinking about the face in a human, the surface is going to be the skin. So now let's think about how we're going to use these elements to produce a beautiful face. First of all, we're going to look at shape. Leonardo da Vinci has told us that the hierarchy for youth and beauty and viable appearances are going to be shape over features, such as the lips and the nose and what have you, versus wrinkles, which will be the skin. So if we start thinking about the human face and the impact of shape, we start to look to see how does the face look as a triangle. We have something that's referred to as the triangle of youth. If we look at Bridget Bardot, this is from the internet, from age 25, she has high cheeks that frame her eyes, the corner of the mouths are up, and she has absence of jowls. As she's aging, at age 62, you can see there's a reversal of this triangle. The jowls are widening, the cheeks are flattening, and we don't think that she looks older. We're going one step further. It's signaling that she doesn't look happy. And if we go even one step further than that, we think, well, what will this person who looks like this, how will they affect me personally? And that's really the human element of shape. We make quick judgments on people based on shape. So if we think about aging face, and this is a client who's at 60 years of age, here she is in her early 20s, and if we look, the cheeks are missing, the jowls are heavier, so there's the reverse triangle of her face. So this is a reverse triangle of youth. We look at her when she was younger, the cheeks were higher, she had narrower lower face, and there's that perceived triangle of youth. So anything I'm going to do to create a more youthful face is going to be to reverse that triangle by restoring the cheeks, reducing the jowls, and we give her that first impression of a reversed triangle of youth. We've recreated that triangle. So as we start looking at the next step and thinking, okay, why does this triangle reverse? We have to think about the face in 2 different ways. And I like to call these quantitative changes and qualitative changes. The quantitative changes are really related to architectural changes of the face. And think about the face as skin that covers bone, that covers muscle, covers fat. The architectural elements are going to be the deep layers, bone, the fat, and the muscles. And as these change, it's going to change the shape of the face. The skin we're going to talk about in a second. That's more of a veneer. That's where the surface is going to come in. If we look at this example, we have someone that's 18, she's 22, she's 62. And we can see the hair remains the same. She's had nothing done to her. But if we look at these elements, she's full cheeks, she has no jowls, beautiful chin, and the neck is tight. So if we look at her at 62 years of age, it's obviously she's lost something. The cheeks are missing, she's gained something, which are the jowls, and something's fallen, which are going to be the jowls and the neck. So if we start thinking about restoration of the face, rejuvenation of the face, whether it be surgical or non-surgical, we're going to be looking at replacing what's been lost. We're going to be looking at reducing what's been gained, and we're going to lift what's fallen. Now, as we do this, we're thinking about the 2 elements of sculpture, which are the mass and the space, which are moving the architectural elements around to create shape. Now, the most important thing that I think is a differentiator for our practice and for what I try to achieve when I'm sculpting is that I have an outcome in mind. And that outcome in mind is that I'm trying to create something that isn't different. If we look at this person 3 years after the surgical procedure and compare her at 65 years of age to 18 years of age, we can see that she certainly does not look 18, but she doesn't look different than she was at 18 when we look at the structural elements. Certainly she's different than she was preoperatively because we've restored the mass and the space, correcting these relationships and restoring her to a more youthful position of her face. And that's going to be our ideas with everything we're doing, whether it be surgical or non-surgical. Now we're going to talk about the last element of sculptural elements, which is the surface. And think about walking into a craft shop and somebody makes, say for instance, clay bowls, and they spin them on the wheel and they all have the same shape. Well, they'll put different colors of patina or different surfaces on them, and one may be more attractive to you than the other, and you'll pick out the one that's more attractive. When you're looking at the face, there's no question that the surface has a big impact on our impression of that person. And in fact, what we find out is that changes in contrast of the look of the skin in color and texture are an indicator of youth, and not only an indicator of youth, but it's an indicator of health. So if you look at somebody from 23 years of age to 67 years of age, we can see substantial differences in the texture of a face. Yes, there's structural changes, but it's going to be the changes in the skin that have a major impact. And under these circumstances, if I'm going to restore the shape to this face by lifting the cheeks, restoring what has been lost, I'm going to reduce the jowls, which have accumulated, I'm going to lift the neck, I've got to address the surface changes, or I'm going to create something that's going to be contrasting, and it's going to be distracting from the overall result. So now what we've explained to you is that we are taking care of 3 elements of the face: the mass, the spacing between the masses, and then the surface changes to create what we consider to be harmonious and changes that are not going to make the person look different than they were in their youth. So if we start thinking about how we're going to establish an outcome that meets a patient's expectations, it starts with us to develop a plan. And this plan we develop by looking at pictures from one's youth to where they are presently. Because if we're looking at the pictures, I'm seeing what I think is beautiful, but it doesn't matter what I perceive as beautiful or what the person wants to achieve. It only matters what the client wants to achieve. Now, if I go back one step and we look at the way plastic surgery is traditionally performed, it happens, a client walks into your office, they sit down in your chair, you do an assessment in all your glory, and you're going to create this art project that is going to be your vision. But your vision may be different than the client's vision. I like to use the analogy of a construction worker. You have a hammer, you have a nail, you have the person says they want to build a building. Well, you don't build the building unless you have a blueprint and a plan in front of you. It starts with design, it then starts with management, and then it starts with the construction and following the construction through the end. So we start this process with the clients to establish expectations by looking at their pictures of their youth and asking them, what did you like about your youth that you don't see today? What didn't you like about your youth that you have today that you'd like to change? Now, if we look at this picture, she's stunningly attractive at age 18. Here she is at age 51. I said, we're going to restore your face to your youth. And she says, but I didn't like my face when I was younger. I said, well, how could you possibly not like the face? She says, I didn't like the fullness here. Because we talk about restoring architectural elements, putting something back. She says, well, I don't want to put this back. I much preferred my face as I matured at age 30 than I did at age 18. And I would suggest that today in Western culture, we're certainly looking at faces with a more angular look, higher cheeks, more hollowness below the cheeks with a strong jawline. If you think back in the 1800s, we certainly liked a more Rubenesque face where it's rounder, fuller features, but that is not what you see today in culture. We're trying to create a more angular look, and she's exactly right. This is a much more attractive picture when we look from her 31 years of age from the 18 years of age. And when you look at her at age 55, she's still in there. We just have to go through these elements. So the next stage is We then compare these pictures, and we look at the width of the face. We start to look at the dimensions of the upper face and lower face and compare them to where she is currently, as we can see from picture to picture. And then I start to look at this in studio lights. And I said, this is where we're going to add, we're going to subtract using topographical maps. Because understand that beauty is the gauge of a successful communication between the participants. And that is the conveyance of the concept of what I'm going to achieve with surgery between the patient and the surgeon, very similarly to what an artist does to the patron of the art, trying to give a perception of what that beauty is and what it will be. So what we're going to do next is talk about the way I differentiate faces, because we understand that everybody is born uniquely with characteristics that are inherently theirs. So we can't look at everybody and put them into each category that's individualized. The O'Daniel face, the Jones face, the Smith face. We can put them into categories, however, before we start to customize it. And I like to look at faces as they age and put them into two categories. One is going to be a depletion dominant face, meaning the face loses volume, loses the architectural elements, and it looks like it's sagging, but the reality is it's deflating. And then we have a face that's going to be accumulation dominant, which means that the lower face thickens, the neck thickens, and that becomes the predominant feature of the aging face. And then we're going to customize once we put them into these algorithms of categories. So first we want to look at the lines of differentiation of the face. If the face didn't have certain attachments to it, as time marched on, gravity affects us day in and day out, our skin would fall all the way to our knees by the time we reach a certain age. Instead, with the grand design, there are ligaments that attach the face, the skin of the face, the elements of the face to the bone to hold it. However, changes occur along those lines, and these are called the retaining ligaments of the face. And this just shows you an overall view. This is a face, you're looking at some muscles. What you're seeing in the white areas, these are all the deep attachments of the face that prevent the face from falling. Now, for those who like to see the true science of it, we can see here these have names. They're Latin names: zygomaticus retaining ligaments, there's the upper cutaneous ligaments, and then the lower massetercutaneous ligaments. And all these little white lines you see in here, some are ligaments and some are nerves. Now, to digress for 1 second, it's these ligaments that have to be assessed, they have to be treated. The problem with most providers, and we're talking 95% of the providers of facelift surgery in the world, is the relationship between these nerves and these ligaments is a daunting task to learn. It's a very steep curve. However, to give the ultimate treatment, the long-lasting, most natural approach, one has got to be comfortable with these ligaments. So if we start to look at the face from the outside, the topography, this is what the person sees when they look in the mirror. You can look at 18 years of age, you can look in the late 50s, a very lean, healthy individual who looks older than his stated age, because health can sometimes not be perceived when we look at the face. We look at the changes of the face. You look at the first shape, the full cheeks and the jaws, the Uji line. We call this the Uji curve. You can now see that it changes, it's irregular, and this is very distracting. And now you look at the topographical map where I'm drawing these black lines. So you can see that these lines are retaining ligaments. They're not letting things fall. And then you see the fat pads underneath. These fat pads are depleting so that the depletion occurs along those lines of attachment. And what we now know is that these lines and these fat pads are all intricately related, and they're separate compartments. So we have to not only understand that you have fat, muscle, and bone, but they're separated into different compartments. And think about these compartments as different rooms in your house. The kitchen and the living room, the carpet, everything in those rooms is going to be much more worn in the rooms that don't get used as often. Therefore, we're going to see more deterioration in the face and these elements. Now, this is what I call the depletion dominant face. Now, this next face to look at is what we call the accumulation dominant face. When you look at this person from his early 20s to 65, you can see that the big element that changes is not the cheeks so much, even though he certainly has some depletion. It's dominant in the lower part of his face. And so we start to look at that. Here's that retaining ligament that I'm talking about. And it's separating the front part of the face that moves up and down from this back part of the face that's very secure. You can see in front of his ear, that hasn't changed over the course of 40-some years. Now, today's facelift, like it was 100 years ago, in the majority of the cases, pulls the skin from back here, and it's changing something that wasn't changed previously. So we have to look at this face in a fashion, where did the change occur? It's out here. And once again, remember the pictures I showed you, the nerves and the retaining ligaments are intimately related right where the action occurs. And so when you look at this accumulation dominant face, you have this fixed area, and then you have in front of that what we call the mobile area. And within this mobile area, we have the rooms of the house. We have fat pads that are discrete masses that accumulate in volume. They're bigger than they were at 20-some years of age, and they've fallen. So it's a combination of more and descent. And when you start looking at the time and you look at the clock, you can start to see the changes in the face. Here he is at age 30. You can see the cheeks were still full. He's lost the cheeks, but what's really happened is you can start to see there's some change in the shape of the face at age 30. That change becomes much more apparent when you see him at age 40. So here he is at 65, here he is at 40. Now you're starting to see the accumulation and that descent when he hits his 40s. This is 65 years of age. Now, when we're restoring this face, once again, I'm going to go back to our earlier description, which is my goal is not to create a 20-year-old or a 30-year-old or even a 40-year-old. If we look at him at age 65 and 2 years after surgical repositioning and reduction of this accumulated and descended lower face, we can see we've created a healthier version of the 65-year-old. Certainly, he doesn't look like a different person when he was 20. You can see there's the jawline, it's nice. He certainly, look at him 2 years after surgery versus 30, I think if I look at the shape of the face at 66, he's got a very handsome face. And if I look at him from age 40, he doesn't look different, he doesn't look 40. I would suggest that he looks healthier. So what we've done is created something that isn't different from 20, maybe more handsome than he was at 30, and certainly a more viable look at age 65 than he was at age 40. So when we start thinking about site specific, we have people come in and we really need to be on the same page. There are elements of the face that change. That you look at her, she says, there's something I don't like. What might it be at age 75? She says, it's this area right here. Today, I've developed an operation that specifically treats this portion of the face and lifts this individual fat pad back into a more normal position. So these pictures become critical to assess what the person sees. Now, as we move into the lower part of the face, we're now talking about the neck. We've talked about the face and the different elements. We also have to assess the neck. And we need to think about the neck, once again, just as sculptors do, because we traditionally have treated the neck by removing some of the fat under the skin and then pulling very tightly one of the muscles and the skin in an attempt to flatten this accumulation. We start thinking about sculptors, it's a three-dimensional shape within the neck, and there are things that change. From early 20s to 50s, we can see there's a change. And that angle, as it changes, is a result of accumulation in this element, just in this, what we could refer to as the submental region. And that's going to be related to fat. When you're looking on the front edge, you can see how clean it is on this view. You can see there's an accumulation here, which is related to glands, muscle, and deep fat. Now, these are going into the deep central neck, and this is like going into the face to release the ligaments. You have to have a very high level of expertise and comfort to go into the neck and create a sculpted neck. But the absence of doing this will not give you a satisfying neck. And I don't think that any place in our history has the treatment of the volume of the neck been more important. Think about the concepts of selfies. And I hear this every day, people coming into my office talking about the strategies they do to avoid what they see. If you look at this particular example, This is taken in my office with the classic photographs that we take as plastic surgeons. We take 5 views: front view, quarter views, and the profile view. And then we show the before and afters, and we then grade ourselves. Ideally, we say, look how great I did. Well, the client really doesn't see what we see. What the client sees is themselves when they're looking at their devices. Today is a device-driven world. You go any restaurant, I would beg you to find somebody that's not looking at their phone at any given time. And most likely going to be 40% of the people looking at their phone. So, this is a picture taken in my office in my typical clinical photograph. The same day, the same patient sends me a picture that evening and says, "Doc, are you sure that you can change this?" Because when he's looking at himself in his FaceTime and his selfies, this is what he sees. This is what I see. Same person, same day. So we have got to address these pictures. And so when we start looking at this, why does it occur? Well, it's going to be changes that occur in this neck, as you can see from these photographs, and they're going to be related to these deep structures of the neck. We're talking about the glands, we're talking about the muscle, we're talking about deep fat. And so when you look at the poses when they look down, look what happens. The skin falls to the chin, it falls down to the shirt, to the dress, and that's going to be because it's pushed downward. When you look down, what's inside the chin gets pushed inferiorly down toward the chest, and that becomes what you see, and that's what everybody else sees when you're looking at your device sitting at the table when you should be talking to the people who are sitting there with you. And when you look down from the frontal view, it becomes very apparent that as the skin approaches the shirt, you can see that these elements are being squeezed downward, which then create this fullness in the neck. So when we're assessing the patient, we have to take this into account, and then we design our surgery to also give us the optimal neck. We have talked about volume of the face and mass and spacing. We've talked about volume in the neck and how it is affected through movement and dynamics, particularly in today's digital society, where we talk to our grandchildren and put our device on a shelf, so when they're looking at us FaceTiming, our chin is upward and we're not looking downward. These are strategies that we have picked up through our own common sense. So now let's cover the last element of sculpture and understand why we're seeing changes in surface area. So think about the skin not as something to be tightened to make the face look more youthful. Let's think about it as a veneer. Let's think about it as a bedspread. We think about the bed when we make it up. We pull the bedspread back. We put the blankets, sheets, pillows where they go. We create the beautiful shape that we all find to be the appropriately shaped bed. Then we pull the bedspread over. Yes, we'll take the wrinkles out and make it smooth, but if the bedspread is tattered, if it's dirty, if the dog's been sitting on it too long, we then need to improve the quality of that bedspread to make it look like the optimal finish. So think about the skin as a bedspread, as a veneer, a covering of something that's a reflection of what's going on underneath. So as we think about the veneer, it's reflecting the architectural elements, and you can see that the changes can be profound. If we look backwards, that not only are we seeing changes in the shape of the face, remember reversal of that triangle of youth, but you can see that these freckles, which were referred to as angel kisses in your youth, were in fact the first accumulation of sun damage that then became deep wrinkles and coloration changes as you age. So we can break down these changes to wrinkles, which we refer to in the Latin name rhytids, and they can be fine, they can be deep, but they deeply impact the outcome, the appearance of the skin. We think about color, we think about texture. And then we also have to understand that there can be iatrogenic changes, and these are changes that occur secondary to previous procedures and changes. So anything that we're going to do to address these elements, wrinkles, color, texture, and iatrogenic, can be done in all different forms, starting from basic skin care, using non-surgical means such as energy devices, different types of lasers, or something as aggressive as surgery with different types of resurfacing elements. So today we have talked about using a sculptor's eye to assess a person's pictures when they were younger, taking our impression of their youth, and then adding the structural elements of mass and space, whether using surgical or non-surgical means, to create the architectural shape, And then we're going to address the surface to improve the quality of the skin, whether it be non-surgical, something done in the non-surgical studio, or something that's surgical done in the surgical suites. So thank you for listening today to my ideas about how to use a surgeon's eye combined with a sculptor's eye to create a personalized and customized result for every person that comes to your clinic. Thank you.
That looks awesome.